Hi guys, Dr. Schwartz at PsychTalk, and welcome to my channel. I just got asked a question in the comments on one of my videos, and I wanted to quickly address it in a video because it's a little complicated and I think it's really important. It was a great question about CBT, cognitive behavioral therapy, and whether or not it's useful, not useful, what does it cure, what doesn't it cure. So here's the thing. Cognitive behavioral therapy, which is a particular type of therapy that is reasonably short-lived and encapsulated and focused and structured. I really like it. I am a psychiatrist, which means that I prescribe medication and I also do therapy. So I have lots of options in terms of treating my patients. And I often refer out for cognitive therapy these days, although I've done a lot of it in the past. I still think it's an incredibly useful tool in certain situations, and that's what's so important to understand. CBT is not a fix-all or a do-all for everything. Number one, diagnosis. It doesn't work for psychotic illnesses, and in fact, it can make things a whole lot worse. So if a patient has something like schizophrenia or schizoaffective disorder or delusional disorder, anything where they've had a break with reality, cognitive therapy is really not appropriate, and it can be extremely stressful. So I absolutely do not recommend it. However, for two things in particular, depression and anxiety, both of those diagnoses, anxiety is not really a diagnosis, but there's a lot of diagnoses under the umbrella of anxiety. For those issues, cognitive therapy, which is essentially teaching your brain to sort of think differently, reframe your thinking. So when I go down a very negative train of thought, I'm going to learn how to stop and sort of send myself in another direction. Cognitive therapy can be extremely useful, and we actually know we can cause structural changes in our brain when we start thinking in a different way. So a really good cognitive therapist can actually give you tools you will use your entire life and can make very dramatic changes. Now, here's the caveat. One of the things I have found with my patients over the years is that they often need to be on medication for a little bit of time, sometimes even a month or 2 months, in order to calm down some of the really severe symptoms before they can engage usefully in cognitive therapy. Not always. Sometimes patients just do therapy and they don't need medicine, and that's terrific too. So it just depends, and all of this requires an evaluation by a professional or professionals or whatever. The other thing is some people are not good candidates simply because they're not good candidates. Since I see children and adolescents and adults, a lot of times teenagers and children are not good candidates because either they're not motivated. You have to be motivated. It's a little bit like going to a personal trainer, really good for you, but not always fun. Or sometimes they don't have the language skills or the cognitive skills to really make good use of it, or they won't do the homework or whatever. So it's not a good thing. So there's a lot of factors, diagnosis, and also factors involving the individual. But a good therapist, a good doctor, a good psychiatrist should be able to evaluate the person and tell them, this is something where I think cognitive behavioral therapy would be very useful for you, or it wouldn't. So bottom line, is it useful? Absolutely. Is it always useful? Absolutely not. That's my answer to the question. I wanted to put that in a video for you. I'm Dr. Schwartz. This is Psych Talk. Thank you, and I'll see you next time.